varicocele. Dilated, elongated, and tortuous veins in pampiniform plexus. Pampiniform plexus is a network of veins surrounding the testicular artery within the spermatic cord. Why varicocele is more common on left side? Because left spermatic vein enters the left renal vein at a 90 degrees angle. Flow is less laminar on left than right, that causes the left venous pressure to be higher than right venous pressure. Longer left testicular vein and the right testicular vein joins the low-pressure inferior vena cava, causes high venous pressure of left testicular vein. Malignant tumors of kidney have a strong tendency to spread along the renal vein. The left renal vein receives the left testicular vein in the male, and this may rarely become blocked, producing left-sided varicocele. Nutcracker syndrome/renal vein entrapment syndrome is characterized by left renal vein hypertension secondary to compression of the vein between aorta and superior mesenteric artery. Defective valves of testicular vein. Points to ponder. Varicoceles are usually visible only when the man is standing or straining. Enlargement usually disappears when the person lies down, particularly if the scrotum is elevated while supine, allowing gravity to empty the veins. Feels like a bag of worms on palpation. Does not transilluminate because they are composed of engorged veins filled with blood which blocks the passage of light. It is the most common cause of scrotal enlargement in adults males. Testicular veins may anastomose with external pudendal cremasteric and basal veins, allowing varicoceles to persist or recur after ablative procedures that do not address their potential collateral effect. There is increased temperature because the engorged veins disrupt the normal cooling mechanism of the pampiniform plexus, and this increased temperature causes infertility as sperm production by Sertoli cells decrease with increased temperature. Symptoms: dull, aching pain in scrotum, visible or palpable enlarged veins, testicular atrophy due to impaired blood flow, heaviness in the testile. It is diagnosed by ultrasound. Treatment: varicocelectomy. A simple surgical technique involving inguinal incision divides the skin around the inguinal ligament. The aponeurosis of the external oblique muscle is divided in the anterior abdominal wall to display the spermatic cord. Careful inspection of the spermatic cord reveals the veins, which are surgically ligated. Embolization by interventional radiologist. In this technique, a small catheter is placed via the right femoral vein. The catheter is advanced along the external iliac vein and the common iliac vein and into the inferior vena cava. The catheter is then positioned in the left renal vein and a venogram is performed to demonstrate the origin of the left testicular vein. The catheter is advanced down the left testicular vein into the veins of the inguinal canal and the pampiniform plexus. Metal coils to occlude the vessels are injected and the catheter is withdrawn. The patient asked how blood would drain from the testis after the operation. Although the major veins of the testis had been occluded, small collateral veins running within the scrotum and around the outer aspect of the spermatic cord permitted drainage without recurrence of the varicocele. Scenario: 25-year-old man visited his family physician because he had a dragging feeling in the left side of his scrotum. He was otherwise healthy and had no other symptoms. During examination, the physician palpated the left testis, which was normal, although he noted soft nodular swelling around the superior aspect of the testes and the epididymis. In his clinical notes, he described these findings as a bag of worms. The bag of worms was a varicocele. The key points have been highlighted and the dragging feeling is due to testicular heaviness. Take care of yourself and the people around you. Subscribe, like, share and comment.